Well, the Affordable Care Act, not so affordable. A new analysis taking a hard look at the individual market premiums in each state. So what is it going to cost you, and which states are the biggest winners and losers under the law? Joining us right now to break down the data is Avik Roy. He is a senior fellow at the Manhattan Institute for Policy Research, the organization behind the analysis. Good morning to you, Avik.
Good morning. How are you?
I'm doing okay, but I'm glad I don't live in the state of Nevada. Let's take a look at some of the biggest losers. If you are in Nevada, your average premium is going to go up 179%. New Mexico, 142%. And North Carolina, 136%. On par like that. How come so high?
Yeah, so it varies widely among the states, but typically speaking, what we're seeing is the states that already had heavily regulated insurance markets before Obamacare,
right,
which is typically the northeastern states like New York and New Jersey.
Sure.
They're not seeing increases. They're actually seeing decreases under Obamacare because Obamacare has this individual mandate that forces people to sign up. Right. Now, in states that had lightly regulated insurance markets before Obamacare, now they're seeing this one-size-fits-all effect where they're seeing a huge jump up in the amount of regulation and thereby the cost.
Okay, so people looking in, they just saw, oh, I'm glad we don't live in Nevada because it went up like a moonshot. But according to your analysis, the average increase in premium, and by the way, those are the states you were referring to, where they were highly regulated, and so there's some savings. The average increase in any state is 41% in the United States.
And that's an average. So the key thing to understand is Obamacare is a war on bros. It's young men in particular who are going to pay a lot more. Young people are going to pay more.
Right.
Men are going to pay more relative to women. And healthy people are going to pay more relative to sick people.
Right. There's a story in the Wall Street Journal today that says that the number of people who have enrolled so far is small. But what's interesting is they're a lot older than they thought. For instance, in Kentucky and in Connecticut, the average age is 55. They wanted the average age closer to 40.
And that exactly dovetails with what our analysis shows, because older people are incentivized to sign up for Obamacare because their insurance is heavily subsidized by younger people and by taxpayers in a way that isn't true for others.
What do you think of what the president said last night at a rally for OFA and his supporters? He said, what we have said all along was you can keep it if it hasn't changed since the law passed.
Well, that isn't what they said all along. What he said all along was if you like your plan, you can keep it, period, no matter what. And now he's trying to backtrack from that, and I'm glad he's trying to backtrack from that because it's a more honest position to say, if I like your plan, you can keep your plan, because that's really what the president's position is.
You've looked at these numbers more than anybody. What's going to happen?
Well, premiums are going to go up for most people, but not for everyone. The key thing to understand is there are these subsidies, and the subsidies are going to kick in for people who are lower income and particularly for the elderly. So what's going to happen? Lower income people and the elderly will sign up for coverage. Healthy people and people of average income and above won't. And so you're going to see this two-tiered system where younger people, or lower income people and sicker people are going to sign up and everyone else will stay out.
Let's see what happens. Still have a couple of months to sign up, actually, till the end of the year, and then right through the end of March.
They may push the deadlines back.
A number of Republicans hope that's true. All right, Avik Roy, we thank you very much for joining us live.
My pleasure.
Excellent.